Joining us now is Dr. Stacie Vilendrer with Stanford Health Care to talk about the latest COVID-19 developments. Thanks for joining us, Doctor. You know, colleges and universities right now are looking at ways to try to reopen safely. How are different campuses handling this tough situation?
There is a range. So the responses range from anywhere from business as usual with some social distancing measures all the way to complete online learning. So I was able to look up some numbers. So in July, an estimated 60% of schools were planning on continuing with in-person instruction with those social distancing guidelines. These are places like Arizona State University, the University of North Carolina, Texas Tech. And some of these schools have even pushed back their start date in hopes that the case numbers in their region will decline before welcoming students back to campus. There are also hybrid models out there. So Stanford, Harvard, and Princeton have adopted a model where they're allowing some students back on campus for the fall semester, but then other students are not invited on campus. They're invited to do online remote learning. So this might be, the freshmen are invited on campus to get to know the schools, but maybe the juniors are not invited right away. And then here in California, the California State University system has decided, at least for the fall semester, that they're doing an online-only model at all of their schools. And that's true for about 10% of the colleges across the country.
So do you see any of these plans changing as some of the case numbers change?
Yeah, so colleges typically have plans A, plans B, plan C. They have these backup plans in place that will change over time in response to changing numbers in their region and on their campuses. So of course you think of how hard it is for a student, a young person, to move in and out of their dorms. That's a lot to ask of that. But you can also think of these university and college administrators, really smart people trying to solve these issues and figure out what is the best and safest approach to learning this fall. And we're going to see a really interesting natural experiment take place. I do research myself, and I have no doubt that there's going to be enterprising researchers that will end up telling us which way was the best. But of course, that's going to take time.
It is going to be really interesting, though. Some students, of course, could be carrying the coronavirus and spread it and not even know it. So when it comes to contact tracing, what tools do we have to prevent these, so-called super spreading events?
Yeah, so these super spreading events are really what we think are driving these spikes that we're seeing in the caseloads now. So typically it should, spread to only a handful of people. These super spreading events, you can see one person spreading it to dozens and dozens of people. And the unfortunate thing is we still don't know what's driving that. We know, outdoor events are safer. People's individual biologies certainly also play a role. But we don't have the answer. We do know that masks are extremely helpful. There is a case of two hairstylists out of Missouri. This is on the CDC website. And they interacted with 139 clients and 6 coworkers before testing positive for COVID. So about half of those people ended up doing follow-up tests, and they all tested negative. And the trick was that these two hairstylists were wearing their masks the whole time. And so, we have studies coming out that are saying these masks are helpful. And then we also have these, situations, these case studies where, that what could have been a super spreading event is prevented because of masks. So that's really, I think, the most important measure we can do right now to protect ourselves and others.
And it's not just the health risks, but you say there are obviously economic risks as well. And it's so difficult, I think, for a lot of institutions to figure out how to balance the two.
Yeah, so colleges and universities are certainly feeling the economic pressure with lower registration rates this semester. I spoke with one student who's taking a gap year, and that woman is not alone in saying, you know what, I'm just going to write off this year from a formal educational perspective, but they might be electing to do other things as well before enrolling back in college. Of course, tuition, room, and board are major sources of revenue for institutions of higher education. And then the costs are going up as well. So cleaning, disinfecting, there's a much higher bar for that. That all costs money. And then technology upgrades for the online instruction are also cost funds. So they're definitely weighing these economic considerations. I haven't been in those rooms myself, but I think from what I see of what's going on around the country, I think there's a lot of careful consideration taking place. And it seems that they really are prioritizing student safety. And we just have to monitor. It's a changing situation, as we've all learned in the last 6 months.
Yeah, certainly. All right. Now, some schools are turning to a new strategy to try to detect potential outbreaks early on. Tell us about that.
Yeah, some colleges and universities are actually testing sewage, so local sewage in the dormitories and apartment units to find outbreaks before they become widespread. This is innovative, even if it's a little unconventional. It's an innovative way to detect an outbreak, as of course the virus is found in the stool. And these dormitories, apartment units represent smaller clusters of people. So if you detect it in this local cluster, the idea is that you can then target that population for additional testing, additional quarantine measures that don't have to impact the entire university or college campus. And of course, that's also good for students because the testing, as we know, is a little bit invasive. You have that swab that goes fairly deep into your nose. And so then that's, that they don't have to do that quite as often. It's a more focused, targeted perspective. So this is a Rochester Institute of Technology out of New York, University of Arizona, Syracuse University are all using this method. And again, this is going to create fascinating research that's going to tell us if this really is an effective early warning system.
All right, Dr. Stacie Vilendrer from Stanford Health Care. Thanks so much for your insights.
Thank you so much, Ann.